Good morning, this is Dr. Fletcher with your Motivational Monday. I'm going to continue our conversation on mental health today with a little bit of discussion on depression. We are dealing with a mental health crisis in this country, and up to 1 in 6 Americans are on some pharmaceutical medication for mental health. Most of these are the SSRI type of drugs. When we see our patients here at Thrive, it's not that we're opposed to medications because we know that some people are really struggling and need to be on pharmaceuticals. But we do also like to address things like their nutrition, reducing caffeine and alcohol, watching the added sugars, talking about an anti-inflammatory diet. Some additional things we recommend are supplements which have been shown to be helpful with mental health, such as vitamin D, B12, methylfolate, those are some, and omega-3s. Exercise is also great. It releases the endorphins, which make people feel healthier and happier, and also can release something called brain-derived neurotrophic factor. Light therapy is yet another thing that can be helpful. But when all of these fail, including maybe not optimal response with the pharmaceuticals, what are a few interesting things that can be used? So a couple things to talk about today. Number one is saffron. Saffron is a spice that's been used in Islamic, Arabic, and Persian cultures and in their medical industry for years for their patients. And they have found that saffron is actually great and very helpful for treating depression. The dose of saffron as a supplement is about 30 milligrams up to 100 milligrams, which can be taken in divided doses. Cooking with saffron is also helpful, but you get a much more concentrated dose when you're using it as a supplement for depression. So think about saffron. It's kind of a newer thought of something that could be used for mental health. There were some clinical studies done on saffron. 11 studies done in a meta-analysis found that saffron, when used in this meta-analysis of 500 patients, they found that saffron was equal to the prescriptions and not inferior to them as well. So less side effects, potentially beneficial. The next option would be St. John's Wort. St. John's Wort has been around for a very long time. In 1984, it was a pharmaceutical prescribing medication in Germany. It was included into their pharmaceutical prescribing practices and has been used twice as much as all of the other anti-prescribed medications for depression in Germany combined. Also used in huge clinical trials, combined meta-analysis of over 3,800 patients with St. John's Wort, again, showed equal outcome as prescription but less side effects. St. John's Wort dosing 300 milligrams 3 times a day. One main caution with St. John's Wort is it can interact with certain meds that use the P450 pathway, and those things would be birth control pills and Coumadin, for example. So just something to be aware of. But a couple things to think about again, interesting herbs and supplements, saffron and St. John's Wort, as well as all the other diet and lifestyle things we talked to you about here. I hope you will have a great week, and if you need to consider these, reach out for more information.